You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. He is probably the busiest implant dentist in all of South Carolina. He is the go-to implant dentist, as a matter of fact, for the entire state. With us, we have Dr. Nathan Faber. Dr. Faber, welcome back to the show.
Oh, thanks, Randy. Happy to be here.
Now, we had you on the program before.
Yes, sir.
Almost 3 years ago. What's changed since then? Anything?
You know, with implants and stuff like that, the people are finding out more and more about implants, and the more they find out about it, the more they find us. And we've been getting busier and busier every week, every month, every year.
Now, we've done the research. You're all over the internet. I guess that's how people find you oftentimes. Is that right?
Yes, sir. Yeah.
And you were saying people have come as far as Alaska to get their new teeth.
Yeah, as far as Alaska. Yeah, that's our record so far.
Now, for people that don't know your practice, and I'm not trying to be on your side here, I've interviewed you before, but the way dental implants are typically done, especially in your state, is it's done in 2 or 3 places. And correct me if I'm wrong. You go to one place that does a surgery, another place where they put the teeth on top, and even maintain them elsewhere. You do all 3 parts. Is that why you do it so quickly?
Yes, we do it so quickly. It's all in-house. We literally make and print and mill the teeth in the office that day.
So you have a machine that makes the teeth?
We have machines that make the teeth. You know, whether we're 3D printing, which is additive, or we have a mill that mills them out just like a normal mill.
But isn't it true? I mean, look, if you have really bad teeth and gums, like you're wearing a denture 25 years, you can't do this, you don't have enough bone.
Oh, you have enough bone.
Really?
Yeah, you have enough bone.
But I even have dentists that have been on the program that really worry about this bone thing. And you disagree with that? Or
I 100% disagree with that. I've had 3 patients in a row this week that have said, my dentist said I didn't have enough bone for implants. My dentist said I didn't have enough bone for implants. My dentist said I didn't have enough bone for implants. Every one of them was a routine implant case.
Well, then why are they saying it?
Lack of training, lack of experience.
Okay.
That's bar none. You know, I really, really invite people to come see me and have a consult, and I'll let you know.
What's your oldest patient that's ever had upper and lower teeth supported by dental implants?
93.
Brand new teeth. 93. Now, 93. Why would a 93-year-old want to do this?
He wanted to eat steak.
Okay.
Yeah, he wanted to eat steak and smile.
Aren't they more likely to maybe come out or fall out if you're 93?
No, if you're healthy enough, we can get them to grow. So
70s is young.
70s, very, very young for that.
And most people in their 70s are on multiple medications, statistically 4. So that is not an issue?
It's not an issue. Now, the only time we ever have an issue is if they're on a osteoporosis drug, you know, for bone, and they just have to take a holiday until we place the implants.
And you'll work with their doctor?
Yeah, we always work with we always work with their primary care provider to get that handled.
Okay,
you know, and we work hand in hand.
Now you say this is, you know, we were talking off camera that it's really life-changing for many of these people.
Very
like
life-changing.
Huge transformations. Give me an example, or give me an insight to that, like what they say.
You know, it's a patient told me one time, and this really, really resounded with me, is, Dr. Faber, I get to go to the restaurant and pick what I want on the menu. Anything on the menu I can have to eat. Anything. I don't have to choose what I can eat in front of other people. And if you don't understand that, or if you understand what I'm saying, you know what I'm talking about. It's, you know, eating that steak or getting that bone-in chicken, you know, those kind of things, and eating in front of people and friends comfortably, happily, and with a smile.
So no more dentures. I mean, we say that at the beginning of the program.
Yeah, no more dentures.
Is that the future of dentistry? Like dentures as we know them will be gone someday?
Hopefully. Yeah, when people know what's going on and how it changes their lives, and as they keep, as my patients keep telling their patients, and we have a couple examples earlier or later probably, that, you know, one told the other, they came in and they're both changed, and now they're referring other patients to see.
Do you ever have spouses or partners that are coming in together? One goes first.
Yeah, we have that quite a bit. We had a husband and wife last year, and it was very, very fulfilling. They came in at the same time and we got them taken care of, and I love them to death.
Yeah, but what if you have gum disease, bad gums? I mean, that's why they lost their teeth in the first place,
Right.
or losing their teeth. Can they still do it?
Oh yeah. That's quite common that patients have periodontal disease, gum disease, as we normally hear about it. They think they've been told they don't have enough bone. They come in, we get out that infection, we place the implants, and we give you those new teeth.
Now, when you say things to me on the phone, like people hold on to their teeth too long, what does that mean?
We've had, since the program's been running and we've been doing this for a while, I have patients that have waited a year and a half to come and see me. And every single one of them, they're like, I wish I'd have came in sooner. I wish I'd have came in right away. And doc, you changed my life. And I'm like, I'm glad I did. Wish you'd have came in earlier too. They say we changed their lives, but they did. They made that call. And I tell patients all the time, they come in, they're scared, they don't know what's going on. I tell them they're the bravest people in the world. And I mean that, because to get over all their anxiety and their fear, to make that phone call and give us a call and let us help them on their journey to change their lives, it's very, very powerful.
It does seem painful though, by the way. Tell me about that.
That's the number one question. Is it going to hurt? Well, it's surgery. And the surprising part about it is that when we do this surgery and we do the implants and we close everything up, we put those teeth on top of where we did the surgery. So it has a Band-Aid, it has a cast on it. And a lot of the times the pain is minimal to none. Patients are really,
they're
really
all
happy.
numbed up, right?
Yeah, they're all numbed up. They're all numbed up. Like, nobody has any problems in the surgery or anything like that. We don't have any numbing up problems, or whether they want sedation or not sedation. We don't have anything chairside that we have any issues.
Are most people getting IV sedation?
A lot of people are electing for IV sedation. The majority of people that aren't getting IV sedation they want their teeth sooner than we can book sedation. And they come in and we give them a different form of sedation, and they're happy to.
And in South Carolina, you think of it as such a healthy place, right? Are there a lot of people either wearing dentures, headed to dentures? Was this a big thing?
Yeah, it's a big thing, and it's a secret. Rarely ever do you have anybody admit that, hey, check out my denture. You just don't hear that, and it's our job, if we make you a denture, that they can't tell. People can't tell, but they're suffering on the inside a lot of the times.
Because you do a little bit of both, right?
Oh, we do a lot, for
a lot of regular denture.
A lot of
not everybody can afford or get.
Yeah, it's not for everybody, and what I tell people is, just because you're getting a denture now doesn't mean you can't have that all on that implant procedure later on. We just know where we're going, but we get.
So you could graduate them to teeth that don't come out.
We graduate them out. That excellent terminology. And, and a lot of them, they'll come back 6 months to a year later, doc, I'm ready. I'm like, okay, let's go. And,
that's nice.
And I always say that's the implant appreciation time, wearing their denture.
Do they ever say when it's all done, how come you didn't talk me into doing this in the first place?
And forget. And I go, I did. And they're like, yeah, I know. But like, you didn't tell me hard enough. I'm like, oh, well, I have to keep a poker face a little bit, because I have to respect your autonomy. But it's the best thing.
Now, at the top of the show, I said you were one of the busiest, if not the busiest, implant doctor in all of the state. Is there truth to that?
I certainly feel like the busiest.
I mean, do the manufacturers tell you you're the busiest guy?
The implant numbers, there's other manufacturers. I use Neodent implants, which is, one of the top implants on the planet as far as implant dentistry goes. And, my numbers are up there. They won't tip their hand to me, but, they nod, wink, wink. I'm doing pretty well.
Good for you. Good for you. You brought some photos. What are we looking at?
Yeah, okay. This first patient is Vicky. She is quite possibly one of my favorite human beings on earth. She texts me all the time, Merry Christmas, Happy Birthdays, how you doing? She's become a friend to me and a friend of the practice. And
so what's going on with her?
When Vicky came in, she'd just been suffering for a lifetime of patchwork dentistry.
What does that mean?
It's a crown here, a root canal there, an extraction here, a bridge there, just one thing after another. Nothing ever stuck and held out.
So it got to the point where what? She needs a denture.
Yeah, denture. But unfortunately for her gag reflex and everything like that, she would have never ever been able to wear a denture.
So no way she was going to have a denture.
No way. Okay. 30 years ago, before we had these implants, it had been a hard road for her, a really hard road.
So what did you do for her?
We gave her new upper and lower teeth on implants, and it's life changing. Vicky is the center of attention in the room, but she couldn't be. She couldn't eat. She couldn't do the things that she wanted to. Suffering from losing all these teeth over the years, and finally she's able to match the insides. The outside matches the inside with her. She's eating, talking. Everything is just wonderful. She's a perfect package.
Now you say that all of these people had regrets. What do you mean?
Wish they'd have gotten it done sooner. They picked up the phone and gave us a call.
So she probably missed out on many years.
Yeah.
Of not being able to do it. Did they ever call you worried about nervous, like what they could eat? Like, Doc, are you sure I could have carrots or almonds or whatever?
I have a phone full of texts of, hey, can I have this? And it's usually after their surgery. And, a lot of times we're doing these surgeries. Hey, Doc, I got a vacation in a month. I was like, okay, that's fine, but you're going to have to limit what you're going to eat.
Just like take it easy at the beginning.
Yeah, take it easy. Take it easy. You're on training wheels. Until we get you in your final bridge, your final teeth, take it easy on it. And they'll text me, hey, can I have this? Sure, no problem. And
now when I look at her after photos, so you're designing everything on a computer?
Yes, sir.
Is that why it looks authentic? Like
Yeah.
Without the computer, it'd be very difficult.
It's very, very difficult. The computer and, we usually have version 1.0, 2.0, 3.0, and then we get to that final version, and we have direct input. The patients are able to talk to the lab technician that's in the office and everything like that, and get everything dialed in for the patient.
Okay, good. We have time for more photos.
Yeah. Okay. So we have Melody here, and this is a direct referral from our friend Vicky.
Okay.
And
from her. Okay.
yeah, from Vicky. And when
boy, that looks pretty.
Yeah. So Melody's been suffering for years, and wonderful woman. Just wanted to be able to eat and do the things and smile and be who she felt like on the inside, on the outside. With her, dentures weren't an option with her. She never even, I tried to talk to her about it. She's like, no, Doc.
She wanted what her friend had.
She wanted the Vicky package.
Okay.
Yeah, the Vicky package. And rightly so, with as much as Vicky brags about it and everything like that. It's really hard not to go with the Vicky package, I guess.
So this is the after.
This is the after. This is not too long after. And that is her smiling. That is her, hey, can you smile for me? Before she's relearned to smile.
What do you mean by that? Relearned?
Relearned to smile. So that's a forced smile because everybody's not used to smiling.
So she's gone so long without smiling
that you forget.
Really?
Yeah, you forget.
That's like a grimace almost.
Yeah, it's kind of, it's you can almost feel the concrete cracking, to get that smile going. And once they break out into their real smile, it's really nice. You see them on the recall in 6 months, and they're bebopping in the office with this big old cheesy grin, and you're like, okay. There's
so after a
smile.
few compliments and they get used to it,
yep.
Then they're smiling all over town.
All the time. It's a lot of fun to watch them open up. Yeah. So we have Lexi. She's one of our younger patients, and she has really just, it's really helped her out. Yeah. She came in, her teeth were great before she had kids. And while she was pregnant and everything like that, it just devastated her mouth. And we were able to have her come in, give her new teeth that day, and really change things back.
So a young person like this could have been in a denture.
20 years ago, it's absolutely a denture. Or she'd have went to somewhere else, it could have been a denture. Yep.
And so you give her upper and lower teeth that don't come out?
Yeah, upper and lower teeth that don't come out. If you look at the picture, she is totally different. And it's
Very
just
nice.
Such a smile. And, if you look at the previous picture, to see the teeth, a lot of the times we have to use those retractors because the patients don't smile.
They just won't smile.
They just won't do it. They won't do it. So we use those photographic retractors
Now,
to get those smiles.
Do you think because of her increased self-esteem and charisma and things like that, that a young person, but the trajectory of her life is probably different now.
Yeah.
What's your take on that?
You know, I think she's able to be who she was before she had kids, as far as socially and doing things and stuff like that. Because she's personality plus. Believe me, when she walks in the office, we all know. And she's amazing. She's a force of nature, and I love her to death.
Are there a lot of young people that are wearing a denture, headed to a denture?
Yeah.
Like 30?
Yeah, there are those. You know, a lot of people have had substance abuse issues and stuff like that have, you know, affected their teeth really, really poorly over a number of years. And
you can fix that?
Yeah, we can fix that. You know, there's, you know, sometimes we can fix them conventionally with crown and bridge, just the normal dentistry stuff. But sometimes it's so far gone that we have to fix it. Okay, good. Time for more photos. Okay. And here we have Bill. Bill's a man's man. You know, he is, you know, his first thing, he wants to eat what he can and everything like that. Tough as nails guy, you know, the perfect patient.
Now that looks unusual to me. I mean, what's going on there?
He's just gum disease, missed some teeth over the years.
Like gum disease meaning what? Bacterial infection?
Bacterial infection.
Can't brush that out?
Yeah, you can't brush that out. It's underneath the gums and everything like that. He had that, some cavities, and you know, and he wanted the Hollywood smile and everything like that. And he does. I tell you what, he's just. He's amazing. Yeah, you know.
So what do you do for him? Okay, so those teeth, he had an option, I guess, a regular denture or new teeth that don't come out. Right. So you remove those teeth, and he gets this. Yeah, we gave him the implant teeth, implant supported teeth. What's it like when a guy looks at himself in the mirror for the first time? Take me in that room. What's that like? It's pretty crazy that they get to see that and they're looking at that. And is it emotional? It's emotional. It's really, really emotional. And what's the best part of it is, you know, when we're in the final version of it and they're looking at one little spot on one little tooth and you're like, do you remember where we came from? Like their goals have changed. Yeah, their goals, they just keep moving the bar on me. I'm like, okay, all right, your smile's an 8.5 out of 10. We're gonna stop there. You know, we're not gonna go to 8.5001. You know, and fix that. You know, we make the smile as youthful as we can for the patient. You know, give them the right things that they have that make their smile look youthful, not flat and stuff like that. And so all of these patients, they're numbed up, they're sedated. Yeah, numbed up, sedated, and you know, hardly any memory of it. And when you do IV sedation, what are you monitoring? Like what? We have that. There's a whole protocol for that. You know, your pulse oximetry, your CO2 that you're breathing off, everything. Your blood pressure, everything. You know, we monitor exactly how they monitor you when you're going into the operating room at the hospital. So we have all the machines doing all the beeps and boops and whistles that keep you going. And how do you know if your dentist has the training or has the experience? I mean, you just ask them, how many have you done? Yeah, ask them. Ask them. And my honest answer is, at this point, I don't know. A lot. I mean, that's the honest answer I can have. You know, I probably do more in a week. Some dentists do in a year or in a career. Okay. You know, so good for you. Yeah. Time for a few more. I'll rush you a little bit because we're short on time. This is good. Yeah. This is Eleanor. She's a lot like Vicky. She's a mother hen that takes care of me and makes sure I'm straight. And she's always mad because usually I'm at one of my other clinics on Fridays, and that's when she comes in for her cleanings at the other clinic. And she's like, I missed you. You need to come on a Friday. I'm like, well, we'll catch each other. Yeah, I love her to death. So so this is a person, looks like she only had like 4 teeth left? Yep. When she came to you? Mm-hmm. How does a person eat like that? It's hard to. And she is as gregarious as you'll get a person, you know. She's the life of the party, everything. And, you know, we didn't slow her down one bit. We just helped speed her up. You know, she was a mile a minute when she came in, and you know, she's 2 miles a minute now. She's eating, doing everything that she wants, and you know, just amazing. So when I look at that before and after photo, in the after, so those are upper and lower teeth supported by, like, how many implants? Like on that lower? 4 on the lower. So like 4 implants there to hold the full arch of teeth. Yep. And what about the upper?
4 on the upper. You know, I typically do 4 to 6 on the upper, 4 to 6 on the lower. Quite often with the advanced techniques I use and the needed implants, the longer implants that I use, it's usually 4.
Now, when they're all healed up, are they limited? Like you'd say, hey, stay away from like almonds or nuts or things like that? Or there's no restrictions?
No rocks.
No,
No rocks. Don't chew rocks. You know, no metal bars. You know, and when we do have our rare break of a bridge or anything, I ask them what kind of rocks they're eating, because it's so rare for things to break like that.
Good. And as far as how long they can last?
They last as long as the patient takes care of them too. You know, they come in for the recalls and stuff like that. You know,
so it's like a regular cleaning, a couple times a year?
Yeah, a couple times a year. And, barring any systemic, biological change, the big C word, cancers, or barring any crazy systemic change in the patient, these things will last a long, long time.
So it's no different than regular teeth. If you take care of them, maybe they could last forever.
Yeah, they can last a long time. Yeah, and, we try not to use the word forever, but a long, long time. I tell my patients in their 30s, in their 40s, that they'll probably, something's going to wear out and we'll have to redo something, years down the road. But, we're planning, I try to build these things to last as long as we can.
Now, for people watching this, we're talking about getting a brand new set of teeth in just one day. Where you are, it's common. You would go to the surgeon's office. That may take 3 months. And then they go back to the other doctor that puts the teeth on top. And in some cases, I've asked around, it could take up to like 1.5 years, 2 years. And you're saying in as little as 3 visits, you get your brand new teeth.
Yes.
Like if whoever's watching this, if this was on a Monday, if you had opening in your schedule, they could have their teeth Friday?
Yes.
Really? Is that rare?
I'm a little bit of a workaholic, so I don't keep my surgery book out too far, because we fit people in, because we want them to get them in their teeth and get them healing and get them on their journey. I hate having surgeries way out on the books. We all do. Like when I've hurt my knee, like, well, we'll see you next month. What? You can't see me next week, and that kind of thing. I feel for the patients, and I try to get them as soon as possible. I think our record came in on Monday on a consult, surgery on Tuesday, so within 48 hours.
They got their new teeth.
They got their new teeth.
Now, we only have about 1.5 minutes left, and I know you have a stack of photos.
Yes, sir.
So I'm going to rush you a little bit.
Okay.
Let's go through these.
Okay. We have here is Tina with her smile. Her smile when she came in was pretty good, and looks are a little deceiving. There's a lot of things that you can't see in the photograph that we see in our x-rays and everything like that. And, little things I see like her crossbite and stuff like that we were able to fix with her new teeth. And she came through this procedure with flying colors, and look at that smile. It's just, it's big, it's bright, and it's perfect. We rounded the edges to give it a little femininity and everything like that. Cuss tips are a little sharp to give a little youth. It was a home run.
And so this is a patient, as young as she is, would have ended up in a denture. Mm-hmm. Is that right?
Yeah. So.
Do they ever come in and say, I don't want dentures?
Oh,
I saw you on TV, I don't want a denture?
All the times.
Really?
All the times. All the time. We hear that all the time. And, and come see me. And if we can't figure it out now, we'll figure out how to get there. And one more, please.
Yes, yes.
So this is Nick, and we've talked a lot about teeth and everything like this, but I want you to look at his before smile. And his before smile is, hey, smile, you have to smile. And his final smile that you're looking at is he gets to smile. Look at that. You can see it in his eyes, how excited he is, how life-changing it has been with me. This one warms my heart more than anything. What
does he say to you when it's all done?
Thanks, Doc. It's really, really hard to put into words how things change, and how he feels and everything like that. But his smile tells me everything. He doesn't have to say a word.
Again, another young person.
Yeah.
But 70-year-old, 80-year-old, 90-year-old.
Yeah.
That's not too old for this.
That's not too old for this. And I hear that often. I'm too old for this. No, you're not. If you have fixed new teeth, you will live longer.
Okay.
So, you will live longer. Look it up.
When you say fixed teeth, meaning that you're giving them teeth that don't come out.
Yeah, the teeth that don't come out, the implant teeth, the all on X, the all on 4, whatever we doctors want to call it. The teeth that don't come out that you can chew with, you're going to live longer. Google it. You know, it's true.
And that infection is gone.
Yeah, we get that.
The gum disease is gone.
It's gone. You know, there's very little correlation between implant problems and tooth problems, periodontal problems like that.
So is it more men, more women, or is it equal?
It's equal. It's absolutely equal. You know, they all have their own reasons and they have their own motivations. But, you know, a lot of them have watched this before and been sitting on the fence. Get off the fence, come in and see us.
Now, you know, we've talked about this, that most of the people you're getting, I guess, still have teeth, but they're in bad shape, right?
Yeah.
But what about the denture wearers? Is it still a challenge to get them in because they don't go to the dentist?
Yeah,
you could help them the most?
Yeah, most of my denture patients that come in, they're coming in for a new denture, and they find out that, oh my goodness, I don't have to have this anymore. You know, and we tell them about it, and they're so happy and ecstatic. They're like, I wish this was here 20 years ago.
Have you ever had a denture wearer that actually, you know, either researches online or sees you on TV that says, this was never offered to me?
All the time.
Really?
Yeah. You know, they'll you know, a lot of times they're from out of town. You know, they'll drive 2-3 hours to come see me and make the drive.
And why isn't it offered to them?
A lot of the times it's just easier just to give them a new denture, or they don't have the training to place the implants.
So they don't know their options.
Yeah, or, you know, that the procedure's so expensive that they're between the two offices, the dentist and the surgeon or the other are at the office, that they just can't do it. And since we're all in one house, we keep our...
So it's one doctor, one fee?
Yeah, one doctor's one fee.
Okay. And we have to mention this, Medicare, Medicaid, even the best dental insurance doesn't really cover this, but you say people are financing this.
Yeah.
More and more, even getting co-signers.
Yes.
Because you have to have okay credit.
Yeah, you have to have okay credit to get this done. And, you know...
But they do it?
Yeah, they do it all the time. You know, that's one of the main things that our patients do. And it's worth it with
like
their smile.
80% are financing this?
Yeah, I would say 80 to 85% are financing some portion of it. You know, and we try to maximize whatever insurance you have.
Okay.
You know, and another doc explained this to me. He's like, insurance makes dental insurance is a coupon. You know, coupon for people that really need some work, and you know, and we work with that as much as we can.
Okay, good. So, final message: somebody watching this, either they're in a denture, really, really bad teeth, but they know they both don't want dentures. Yeah. What do you say to them? They're skeptical. They've heard you. They've watched you. What do you say to them? They're still afraid to do it.
Come in and see us, and we'll show you. And it's pretty seamless. It's very streamlined, and we can take good care of you.
Well, thank you for coming on the show. Good stuff. Always good.
Thank you,
Thanks.
Randy. I really appreciate you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.